119. So as you can see, it's not actually that bad. And if you look through, if you just take a quick flip through exercise 15 and exercise 16, we start with the ventral muscle dissection, which is fine. It's just the front of the cat. Then we go to the dorsal, which is the back of the cat. And then there's some nice images. You've got a nice kind of drawing labeled of the front of the cat. And it's not actually all labeled, but then we've got some images throughout the lab manual that have a lot of labels in them. So that's really nice. You've got some of the labels. And of course, you can just take pictures of the things here. Okay. So that's it. So where we're going to start and where we're going to end is on page 119. So just a quick reminder, guys, that there are some blue boxes here. The blue boxes are additional things that they want you to know because it's testable material. We're going to talk, one of them said, reminds us about the iliotibial tract, which we're going to see, no problem. The Achilles, or also called the calcaneal tendon in the second blue box, also not a problem. The problem is I couldn't find the images with the sciatic nerve. So I'm also waiting on that information because I went back and I looked at the posterior muscle folder for the cat and I didn't see it. So you have to actually remove the muscle out of the way and dissect it in order to see the sciatic muscle nerve. So currently we don't have an image that I saw that shows the sciatic nerve. That's okay. I'm just waiting on information. So we can, look at this when we come back as well. And then you should know the function of the muscles of the cat that are also on the human model. So most of them are on the human model. So just make sure that you know the function. Again, what does it do? Does it cause flexion at the elbow? Does it cause extension at the hip? Does it cause rotation at the shoulder, right? So just make sure that you're reviewing that. What that means is once you're done today, I would review the muscle model, all the muscle models and then the cat muscles together, right? Because then you can be like, oh, this has this function, this has this function, and you're studying it at the same time. So that's what I recommend. All right, so that's your blue box reminder, okay? All right, so with that being said, we're just going to jump right in. Again, ventral muscles are exercise 15, dorsal muscles are exercise 16, but we're just going to go down the list, kind of. It's not going to be exactly top to bottom. All right, so this is also, remember guys, you have the video from Dr. Schultz. So you can take a look at her doing the dissection. It's great. It's nice to kind of see on a video what I'm talking about in these images. In addition, I do have some of my other publisher images. Some of them are good, some of them are bad. We'll see how much help they are, but they're labeled and I like that. Anyway, that's it. So we're starting with the ventral muscles. And then Dr. Schultz recommends that students learn them in kind of the groupings where they're found. The ventral muscles, as per the video, are usually found in groups of 4, which means memorizing these together in groups in whatever order you like, which I'll talk about in a little bit, is the way to go. Like anything, you want to chunk the information, right? Just like you did the bones. You did the skull and then the face, and then you went down inferior. So that's how you want to approach this. And again, I do recommend that you do it along with the muscle models because then you can knock out the function at the same time. Okay. So pectoralis group. So this is all part of the pectoralis area or the pectoral muscle, right? In the muscle model, we just call it the pectoral major. That's it. But here we kind of segment that into different regions. What do we mean by that? Well, this one is part of the image that I have in my other publisher, but it's great, right? Now, this is going to be one of those image sections where you really have to watch your orientation. Remember, we really hit that hard when we talked about the arm specifically, right? The leg is much more, I think the leg is just easier to see where they're orienting, right? It's pretty much an anterior image of the leg, a posterior image of the leg, and then a lateral image of the leg. I mean, we do have some where you can see obviously the middle, the deep middle muscles, but the orientation is much easier than the arm, especially our arm models. And remember that just a little change in the arm model, you really have to follow the elbow, because you're like, wait, is that the long head of the triceps brachii? We have that discussion. So you got to watch that. It's similar here, but more on a bigger level. By that, I mean, you've got to know whether you're looking at the front of the cat, the back of the cat, the arm of the cat, the leg of the cat. Now, we all know cats have 4 legs, but compared to our body, the front legs are analogous to our arms. So I'm going to call them arms from now on. Even though we know cats don't have arms, they have 4 legs. But again, the muscle groupings are analogous. So when the time comes, as per Kimberly Dutton Images, I'm going to tell you, watch out for orientation, right? Because I have had people in the past that just, I don't know what happened, but they lost their orientation and they gave me arm muscles for the legs. So you don't want to do that, because obviously that's just gone. So with this being said, unfortunately, we don't do this, right? We don't do the pretty cat where it says this is the anterior part of the cat. Specifically, this is going to be the abdominal and chest area, right? Thoracic and abdominal. Yeah, I know. The cat's great. You're not going to get that. But, most of these images from my other publisher, actually it's the same publisher, it's just a different book. Anyway, most of them are good, except for the lateral part of the leg, the quadriceps. They're garbage. But anyway, so with that being said, we're going to start, if you go to the 6th muscle on ventral muscles on page 119, we're going to start with pectoral. We're going to start with these 4 muscles. Now, I like to start with the inferior muscle, okay? So I don't care about these. What I care about is the pectoralis muscle groupings, which are going to be in this area here. Okay. Now, this is not Kimberly Dutton. I'm introducing it because it's labeled, and trust me, my friends, it takes a lot of work to label stuff. So, I'm going to give you the best you can get while still managing my time. We had some of them, but it should be on your atlas. Isn't the label models the human one, or do you mean the Mini-Man? Do you mean the Mini-Man? Because I'm almost positive the atlas has the arm and the leg. Doesn't it? Yeah. Okay, in the book for the Mini-Man and the woman. Okay, yeah. Yeah, the atlas, honestly, I'm not stressed out for you guys because the atlas has everything, right? But remember, this is a way for me to introduce it all for you, give you the caveats, watch out for this. But the atlas should have everything. I don't know if it has the Mini-Man, though. So it doesn't have the Mini-Man. Is that what we're saying, Gloria? Okay. Yeah, it has so it has the arm, it has the leg. Yeah, the Mini-Man, yeah. I don't know. Sorry, guys. What did we, I think I just had some illustrations for mine. Yeah, it can be tricky with the orientation, mostly of the triceps and whatnot. The legs are pretty straightforward, though. Really? I thought the lady's muscles are much clearer than the man's, to be honest with you. I thought hers were really nice, especially the back. Her whole infraspinatus muscles were really pretty. The back of the arm can get tricky. So I'm not sure about the back of the arm. Yeah, I'm not sure the best way to do that. I would just say maybe look online to see if you can get any labeled ones. Yeah, check online to see if you can get any labeled ones. Then you can kind of focus on the arm as well. You can also try to use the arm model to help with her arm. But remember, we're not really trying to drive you crazy with it. Just, wherever we can see things clearly. All right, so with that being said, let's go. I like going from inferior to superior with this guy. So here we've got this lovely V shape here. And that lovely V shape is the Ziphy or Xiphie humoralis, okay? It's janky. You got to practice writing these because, who knows Ziphy humoralis? Okay, we've got the humerus. That's great. IS, right, related to the humerus. That's great. AL is the muscle, right? We usually have that, like the frontalis. We see that, right? So humoralis, we can associate that. Ziphy, I don't know. Xiphie, I don't know, right? Someone already tell me what that is. I don't know what it is. But you have to know that it's this very inferior portion of the pectoralis groupings, okay? The next one going up will trick you because you will call this the pectoralis major. It is not. Even though it looks bigger than what we're about to talk about, it is not. This is the pectoralis minor, okay? The pectoralis minor is, if you go inferior, it's just superior to the Ziphi humoralis, okay? That's what, like, so I like to go in a particular direction. If you want to go superior to inferior, no problem. But I would pick a direction and learn it in that hierarchy, right? So in this case, we've got the pectoralis minor, and then we've got the pectoralis major in this area here. So the issue is that you can't see most of the muscle. It goes a little bit deeper. So we only kind of get this kind of peekaboo pectoralis major. Dr. Schultz talks about that as well in the video. Lastly, we've got something that we don't have, but it's kind of a grouping of these muscles, right? We've got the pecto, right, pectoralis, antebrachialis, right? Because it's going to kind of go over a little bit. So that part up here, kind of like a clavicle collar almost, a muscle for the clavicle area, that's going to be the pecto antebrachialis. Okay? So that's what we have. And we don't care about the abdominis muscles right now, the abdominal muscles. All right, guys, so that's what we have here, but let's go to Kimberly Dunn. Okay, so there's Kimberly Dunn. If we start on the inferior, but before we do, here's my caveat. You've got to recognize where you are quickly. Now, this is not bad, mostly because you're going to know what these muscles are, right? Mostly because you're going to know that this is going to be the ventral or anterior muscles, right? You might be able to recognize this is the front of the neck, right? But you can't see a jaw, but you need to recognize very quickly that this is going to be the front of the cat. Okay, guys? From that, recognize that, again, I like going inferior to superior. So it's going to be the Ziphi humoralis. Okay, both sides. It's going to be the pectoralis major. Now, this one's kind of hard. They didn't really separate it, so I'm going to give it a separation there. Okay, pectoralis minor. I think I just said major. Bad. Minor. Yeah, pectoralis minor. And then going superior is the pectoralis major. So here obviously they're going to label this side because they've given you nice cuts they've separated those muscles very, very nicely. So that's the pectoralis major, smaller, but it's because it goes deep and you can't see it. And then lastly, you have the pecto antebrachialis right here. Okay, guys, you see that? So if you like superior to inferior, you're going to go pecto antebrachialis, pectoralis major, pectoralis minor, Ziphi humoralis. If you like inferior to superior, you're going to go Ziphi humoralis, pectoralis minor, pectoralis major, pecto antebrachialis. Make sense, guys? All right. With that being said, I like inferior. Where's the Ziphi humoralis or Ziphi humoralis? That's it. Now, almost for sure, they're just going to stay on this side, right? Because, like, on the right side of the cat, because it's just nicely segmented. All right, where is the pectoralis minor? Awesome, that's it. Boom, no problem. Notice this, 4 muscles, superior to inferior, inferior to superior, whatever you like. Pectoralis major. Awesome, that's right. And then lastly is the pecto antebrachialis. Awesome, guys. So this is most of the cat muscles. Most of the cat muscles are quite straightforward. So even though you only have the pectoralis major that you have to know on the human, right? Just put it all together because it'll be much easier. All right, awesome. So that's what we got. Good. All right. So with that being said, we're going to go down. We're going to go to the abdominal muscles, right? 4 abdominal muscles. And you can follow along. You can see that we're kind of not going exactly in order. I'm pretty sure I actually took the order that Dr. Schultz goes in here. So that's what we're doing. All right. Again, another set of 4 muscles. So that was all kind of the thoracic area for the chest muscles, right? 4 of them. Knock them out. This is going to be the abdominal area. As you know, they're the abdominal muscles, right? So now, very quickly, remember, guys, in the muscle, in the man, and what else do we have? I think do we have like torso. No, we only have the muscle man for the abdomen, for the abdominal region. So remember that we only have 2 layers on that man. In other words, we've got the external oblique because it's on the external. You don't have to kind of remove a layer. And then the second layer on the man shows the rectus abdominis very clearly. And then it shows the internal oblique. On the muscle man, you can't see the transversus abdominis. Now, here they call it the transverse abdominis. Just use the wording here. If you look at your textbook, it should say transversus abdominis, but that's fine. Just go with the wording here, right? Here, you will be able to see all 3 layers, right? External oblique, layer 2. Rectus abdominis, internal oblique. Layer 3, transverse oblique, okay? So that's transverse oblique. Transverse abdominis, wow. So we take home message, 3 layers, you will be able to see them on the cat. So just keep that in mind. All right, with that being said, here is the labeling, and this is still nice, right? I like this. It's labeled well. Hoorah. Okay, so what do we have here? We have on this side, this is the right side of the cat. This is the left. And again, they give you cute little orientation. You don't get that cute little orientation on Kimberly Dutton, right? So just be aware. Make sure you're orienting yourselves very quickly. Front, back, arms, legs. That's basically what you have to do, okay? I know. Well, you know what? I just don't think anyone's really thought of it. Like, at some point, I should probably tell them, hey, let's put a little cat, like, hey, I can cut and paste this guy, or whatever. This is just from another textbook, another thing. So anyway, right side is going to have layers and a few labels. No. Yeah, seriously, kitty anatomical position. That's like no joke. Seriously, that's exactly what it is. I know. It's funny, but absolutely true. Now, we don't care about left and right side. We don't ask you for any left and right, but we do care about front, back, neck. You know what I mean? The neck muscles in the back, the neck muscles in the front. Thankfully, the neck muscles in the front, you can actually see the cat's head. So you're like, oh, that's a mouth. So that makes it easier. All right. So with that being said, very quickly, we've got 3 layers of muscles, like we saw in the mini model, but you can't see the 3rd layer. Here, no cut being made. So you can just see the external oblique here. I need to slow down. All right. So here they've labeled it. It's the flap. Okay. Now, the second layer, and I have to just see how they've done this. Okay. The second layer here is this. Now, again, this is not Kimberly Dutton, so just let it wash over you. The rectus abdominis goes vertically. The internal oblique goes here. And they've made a cut here. Okay? The blue is layer 1, the red is layer 2, and the green is layer 3, which is the transverse abdominis. So this is just getting you kind of primed for that, because our transverse abdominis is like very, very small. They've removed a lot of this second layer, okay? But that's the key here, okay? Layer 1, layer 2, layer 3. All right, with that being said, okay, so guys, here we go. Now, this is actually not what we're going to use because there's only an external layer. In other words, we haven't actually gone to the 2nd or 3rd layer. So the rectus and internal are on the same layer. Yes. Yes, 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 which I will show you very clearly in just a second, Brisa, but absolutely. And I'll explain how that works. Now, in this particular picture, it's okay. I'm going to show you. Don't stress out. I'm going to show you. You'll get it. It'll be good. It's it's not really this one, guys. So this image, this image confuses me because what can you see? Well, you can see the external oblique, right? You can see the linea alba. Right, that's like the big kind of line in the middle. You can see the linea alba. Now, you got to know, guys, legs. Okay? And look, Xiphi humoralis, right? Pectoralis major. Minor. Pectoralis minor. All right, but they haven't cut into, exactly, minor. But they haven't, so they've cut it, but they haven't removed it, right? So we really only see one layer here. So that's what you can see in this image, okay? But I just want you to know where you are because it's on there. So I don't know. That's what you have in this image, right? You have the linea alba, which is just the center part here. The rectus abdominis is all under the white part, but the rectus abdominis is in the second layer, so we usually don't, like, we're not going to label it here. Looks like a turkey on Thanksgiving. Yeah, no, seriously, it does. It looks like chicken legs. When you get down to its legs, it looks like chicken legs. You're like, Mom, I told you don't come in till I'm done. She's like, they killed. Oh, well, do they kill it? Okay, we won't talk about it. Let's keep moving on. Oh, no. We won't talk about it. Moving on. Oh, I've got two of them. I'm very weird. I have no problem dissecting cats, and I have two lovely cats. I always wonder what my cats think when I came home after lab, because I smell of dissection when I come home. Like, it's just a lot. But probably the formaldehyde, the paraformaldehyde that they keep the cat in. But my cats, I come home and I'm just like, lab coat, juicy lab coat and all that stuff. And I stink. And I'm like, oh, they don't seem too offended. I know. That's the benefit of online learning. You don't have, like, cat juice on you. Yeah, exactly. Gloria. I don't think you have cats. You're giving them way too much credit. I could bring, like, one of them home and they'd be like, sorry, guys. Yeah, exactly. They're like, yay, until the summer. Sorry. Yeah, dogs could probably tell. All right, anyway, so let's go, guys. Zombie. They know. Maybe they do, they just don't care because they're so old. They're like, well, I've already lived long enough. All right, now, this image, guys, this is going to be your... Yeah, they're used to me. They are. Oh, my God, they're so old. They're 14 years old. Aww, they're going to die soon. Anyway, I know, they're amazing. They're so sweet. I love them. All right, anyway. This is the image you're going to be tested on. So let's orient ourselves. First of all, don't worry about head or heads. There's only one head. We don't have mutant cats. Don't worry about a head or legs or arms, because this is going to be the abdomen, right? Obvious. How would you really know? Now, when we talked about the three layers go like this. The very outer layer is peeled back, right? Because remember, we have to go 3 layers deep to get all the muscles, which means this layer here, maybe I'll stick with the same color. External oblique. You see this? Here, here, here. That's the external oblique. Okay, guys? So not bad. It's the layer that you don't need to peel back. You're like, oh, boom, that's the external oblique. Okay? Now, with that being said, we're going to go to the next layer, the second layer. Now, I'm going to color all of the second layer so that you can see it first, okay? So don't worry about separating the internal oblique from the rectus abdominis, but I think you probably can. But I'm just going to color all of it because I want you to differentiate each layer because that'll be easier for you, right? So the second layer is all of this. Okay, guys? That's all the second layer. Now, I'm going to differentiate the third layer so that you can also see, okay? That's it. All right, guys. Can you see first layer, second layer, third layer? First layer is red. Second layer is blue. Third layer, and it's not a lot. It's just like a ribbon kind of thing. The third layer is green. Gloria, go for it. Now, I haven't separated this between internal and rectus abdominis because I just want you to get the layers. Gloria, go for it.
So this is external, this is internal, and this is transverse?
Yes, but I haven't got there yet. You're jumping ahead.
Okay, sorry.
But yes. Yes, you're absolutely correct. I mean, that was great. That was good. So you are absolutely correct. And I wanted to just give you that. Yeah, exactly. Good job. Very good. Exactly. So with that being said, I will further differentiate with colors. Okay. Same thing here. External oblique. External folded over, right? We had to cut it to get underneath. This is layer 1, right? External oblique. Okay, that's layer 1. And then we're going to go to layer 2. We're going to make the internal oblique. We're going to make that blue. Okay, internal. And then we're going to make the rectus abdominis, which is here. That's an ugly color. I'm going to make it white. There. So I'm going to make it white, and that is the rectus abdominis. So technically, look, it's going to go all the way to the midline, right? But you can't see it here because you have to go to the second layer, and they have it open. You see how they haven't opened it all the way, right? So in that case, the white part here, and it continues. So don't think it's a pretty wide muscle on both sides of the linea alba. But this is what you can see here. Okay, that's it. And that's going to be the rectus abdominis. You can kind of see that weird R. And then lastly, so blue and white are in the same layer. And then lastly is that third layer, which is the transverse. And transverse abdominis is going to have this orientation of fiber. So basically what happens is blue and the white are connected. So they're connected together through this connective tissue here. And then you've got to cut that and open it up. Now, what invariably happens in the lab, and I've done it too, is that transverse layer, the third layer, is so thin that everybody cuts through it, and then you're like right into the digestive organs. And you're like, oh, damn. So, green was transverse, yes. Green was transverse. All right, guys, does that make sense? Red is external oblique. We don't have to remove any layer. It's the outer layer, layer 1. Layer 2, we have to open up that external oblique. The layer 2 is going to be internal oblique, right? It's going to be more lateral. And then the rectus abdominis, and that's going to be more medial, right? Going kind of, but you can see this orientation is a little janky. And then the third layer is the green one here. That is the transverse abdominis. Oh, wait, did I screw something up? Did I mess it up?
No, just what you said when you cut through the transverse, and I'm like, they raise their hand and they're like, I messed this cat up. I need another one.
Oh, oh no. We just know it's funny because so the I guess so. So in lab, we have it in, just so that for your information, in lab we have a instructor cat. So really everybody, usually the people who are most interested take the lead in the dissection, and we always have a handful of people that are really good at dissection. But then, people are new and they're just like, and they're like, oh man, I just like got an organ. Like, right? It's just like, oh, it's a small intestine. So, it's not that bad. It's just funny because they're so thin and the transverse muscle is so thin. It's so easy just to like, boom, and then you're like, oh, internal organs. So we basically just say, no problem. You got the other side. Go to the right side. So whatever. But it's exploratory. We teach them off of the instructor cats. We teach them off of the beautifully dissected cats, and then they just mess around with their cats. All right, guys. With that being said, layer 1, 2, and 3. Where is the external oblique? Yep. Either one, right? Because it's all there on the outside. Yep, all of that. Great. Now, we wouldn't want to go actually to the middle because remember that aponeurosis, that white part, would actually be covering the rectus abdominis. So we just want to kind of stay more lateral on the first layer for that external oblique. All right, now, where is the internal oblique? Yeah, boom, that's it. You got it. Now, don't go too far, although technically it does go kind of far because we only see a little bit of the rectus abdominis. Awesome. Now, where is the rectus abdominis? We don't see a lot of it in the second layer. That's it. That's it. Just where everybody has it. Yeah, don't go any further. Now, we would need to peel back that top layer more and go to the midline. So yes, underneath this white aponeurosis, that is it would go this way, rectus abdominis. We only see a little bit of it, right? That's where we're going to go. Now, where's the transverse abdominis? And that's just a super small part. So it's not actually the yellow line. It's actually this part. Yeah, it's right there. That's it, just there. Right? You can see that third layer. So you got to be careful. Like, I don't think we'd make it janky, right? I feel like if we're going to ask, we're going to be like, okay, external is very straightforward, right? I feel like we're going to be like, oh, what is this? Oh, well, that's the internal. And then it'll be like this. Oh, what is this? Oh, okay, well, that's the rectus abdominis. And then it'll be like, oh, what is this? And exactly. That's what we're going to do, right? And that's going to be the transverse abdominis. Okay, guys? So, knock it out together in groups of 4. And that's it. Awesome. Okay, so let's keep going. We're going to go to the thigh, the ventral thigh. Now, this is actually quite nice. So, again, orient yourself appropriately. Now, there's a tail. That's a scrotum, in case you're wondering. So, you know that these are legs, right? Now, that's the stomach. How do you know? Well, there's your linea alba. That's the one before where we had, like, just one cut. It's kind of like they were like, I don't want to do this one. So again, that's the abdomen, which means ABD, which means that's going to be ventral. That's going to be very important, right? That you notice that this is the ventral or the front of the cat, okay? Now, in this image, what can you see? In this, it's kind of they took it from a little bit far back, but let me tell you what you can see. Technically, you can see the external oblique, right? Technically, right? You can see the linea alba. I don't think they'll ask it here, but I mean, I gotta get you ready, right? And yes, the Xiphi humerus, I don't think they'd ask that, but yeah, and they definitely would not ask you about the pectoralis minor because it's just like, But what I'm thinking is, based on the leg here, they're gonna ask you for either the gracilis, remember? Wait, I lie. No, I don't lie, I'm right. Gracilis. Okay, so how you can think about this is the cat's legs are splayed open, right? So that's kind of going to hopefully orient you a little bit. So that's the gracilis there, and then the sartorius. Now we have to transect them or make a cut in a perpendicular fashion across this muscle, the fibers, because we can't get to the adductor muscles under the gracilis without opening it up and seeing it. And we can't get to the quadricep muscles under the sartorius without opening up. So in this particular image, okay, now, from all the images that I've seen, the best image for the tibialis anterior, and I'm going down a little bit, is here. Okay, guys? I have not seen a good image for the tibialis anterior. So I'm jumping a little bit because that's at the very bottom. And technically it should be with in the next set of slides. But with all the slides that I've seen, this is the best image. So basically the idea is the lower leg, right? For the calf area, there's only one muscle. It's going to be the tibialis anterior. So in case there's an image that I didn't show you, in the back, we're going to see the gastrocnemius, we're going to see the soleus, and we're going to see the Achilles tendon, right? That's it for the back. For the front, for the lower leg, right? It's only the tibialis anterior. And this is the best image I've seen that. Regardless, if you get beneath the knee and it's the front, it has to be the tibialis anterior. So, all right. So that's kind of what we have here. We could ask you for the gracilis here. And I guess we could ask you for the sartorius here. You can kind of see where they started to transect that. Okay, guys, does that make sense? This is just a weird image. I'm just going to be honest with you. But I'm just prepping you because I don't know. If it's Kimberly Dutton, it's open for, you know what I mean? They can ask. All right, guys, with that being said, where's the external oblique? Because, again, it's there, so theoretically they could ask for it. Yeah, on both sides, exactly. Just don't go to the middle because underneath the white part, that aponeurosis, is the rectus abdominis. All right, where is the gracilis? Yeah, it's there. It's on the inside. It covers up the adductors. Yes, on both sides. Good, good, good. It's good to know both because I don't know, right? All right, good. Where is the sartorius? Yep, that side and there. Yeah, it's basically just above the knee, right? Superior to the knee. Yeah, that's it. Good. Now, in this image, where would the tibialis anterior be? You can kind of see it. It's like a thin muscle. Yeah. Yeah, that's it. And again, there's nothing on the ventral anterior side, the front, underneath, like inferior to the knee, but the tibialis anterior. So that's kind of, one of those things. All right, guys, awesome. Okay, this is going to be the image they're going to ask. I mean, almost 100%. But if they've got an image and they put it on Blackboard, I'm not going to ignore it, right? So, where's the gracilis? Same thing here. Where's the gracilis? That's it. Boom. The whole thing. Yes. Good. Now, where is the sartorius? Okay. Now, you can see the tibialis anterior, so I kind of lied, actually. Can you see it there? Yeah, you can see that. It's really super thin. Yeah. All right, cool. Now, I don't know. I don't think you'll have this image, but I do want to introduce the adductor muscles here in case they do for some weird reason, right? So, the key to the adductor muscles is the femoral vein. You guys see that? Yes, I know I just made it red. That femoral vein is the key because right beside the femoral vein is the pectineus. You see that tiny little muscle there? It's like a little triangle. That muscle right beside, right medial, right or left, directly medial to the femoral vein is the pectineus, which means continuing on a medial fashion, the next one is going to be the adductor longus. And that's all they could really ask you. We've got something here, but you can't really see it. It's tucked away. Does that make sense, guys? Let me show you again. The femoral nerve is your boundary for the adductor muscles. Start with that, and then go femoral, I call it not nerve, femoral vein, and then go medial. So when I go right to the medial of that, it's going to be the pectineus. All right, guys? Keeping medial, right, going to the midline, right, is going to be the adductor longus, just like we have. Right, guys? And we see that femoral vein in the body as well, in the muscles. We've got the femoral vein for the deep thigh muscles, and we go pectineus. We find the femoral, go right, go medial to that, and you get the pectineus. Medial to that, you get the adductor longus, and then things get a little different. All right. With that being said, probably they're going to ask for either the sartorius. Where's that? I'm switching it up a bit. That's it. Gracilis. That's right. Where, just in case, although I don't think so, but I got to prepare you, where is the pectineus? It's small here. That's it. Oh, that was the tibialis. Oh, you guys jumped the gun. Y'all thought I was going to say tibialis. Yeah. You know that's not the pectineus. You guys were just like, she's going tibialis anterior. Not acceptable behavior, people. Yes. All right, with that being said, where is the adductor longus? That's good. Awesome. That's it, guys. So again, this is a good example of, you're going to get the same. Now, the sartorius in the human is different, right? We have a very nice ribbon looking, starts up at the ilium, probably in the same idea with the cat, but that's going to go all the way across just above the rectus femoris. And then it's going to go, our sartorius goes to the midline, to the middle part of our knee, right? So we're going to go down to the tibia from our sartorius. But it's the same order of muscles. So study them together, and especially the function. All right, awesome. So we're going to go, we're kind of jumping back out. I wonder, you know what? No, I lied. I'm going to keep going with the adductor. Hold on. I'm going to come back. I'm going to come back. Okay, so because I just introduced the pectineus and the adductor longus, I'm going to keep going with that. And then I'm going to come back to the sartorius and the quadriceps, right? So where are we here? This is Kimberly Dutton, right? So I don't think you should have a problem, but that's a tail. So that's the back. So obviously that's a leg, right, guys? Tail, leg, okay? And you want to recognize that this is going to be the abdominal or the abdomen, right? Linea alba. Here's the aponeurosis that covers the rectus abdominis. All right, guys? Because you don't want to call this an arm. This is not an arm. This is a leg. All right. Because again, I did have some students in the past thinking this was an arm. Now, I don't think it looks like an arm, but you got to make sure that you're aware of that. All right. With that being said, notice what's happened here. They have pinned back the gracilis, and you can't really see the other part of it. So that transected muscle, that perpendicular across those fibers, they've cut it and then peeled it back. Just like the arm, you have to cut that lateral head of the triceps brachii to get in and see that medial head from the back, from the posterior part. In this case, again, I'm just going to stick to what we're doing. So gracilis pulled back because you can't get to it. Now, notice what they've done. Do you see? They've taken that probe and they've pushed back the femoral vein. Doesn't change our orientation. We still go femoral vein. We're going to go medially. Pectineus, which is, you can see a little bit longer here because they pulled back that vein. There's the pectineus. I'm changing colors here. Sorry, guys. Adductor longus. Okay? Now, this is new. This is new. In other words, we don't have this designation on our body. This is the adductor femoris. Also looking kind of like a triangle. So again, guys, I jumped past the quadriceps for now because I kind of started with these adductor muscles. So if you go down past the quadriceps femoris under the ventral muscles, we did pectineus, we did adductor longus. Unfortunately, this is not the order. It goes pectineus, adductor longus, and then adductor femoris. Shark tooth. Yeah, shark tooth. Perfect. Do it. And then what we have after that, and this gets a little different. Okay, guys, watch. And then we have the semimembranosus-ish. Semimembranosus. So what happens is the cat's leg is splayed open. Yes, the semimembranosus is part of the hamstrings in the back. But look at the cat's leg, right? It's splayed open like that. So you really see a lot of the semimembranosus on the cat, and you see it on this ventral image because of the way the leg are opened like that. All right, guys, does that make sense? And they want the semimembranosus, don't they? Hold on. This is janky. It's fine. It's just janky. Yeah, they do, but you can't see it. You can see only a little bit of it. And this is the semimembranosus. I know. But you can only see a little bit. And I'll show you what that means in a second. So hold this in your head. But this is how the orientation goes. So, again, it goes like this. Because it's right in terms of the leg, but it's on the ventral model. So, and you can double check. Go to your Vimeo, right? And see how Dr. Schultz goes over it. All right? So, again, in this case, we're looking at pectineus. Brisa, go ahead.
So, in the previous picture, is the adductor longus the one that's like peeking out on the side?
So, the adductor longus, let me show you. So, I jumped past the quadriceps.
Right here.
So this one is actually, that one is, the peeking out is actually the adductor femoris. And it would be the one that I just showed you.
Okay, yeah, that's what I meant to say. I'm sorry.
Yeah. Oh, yes. No, that's okay. Yep, that's the adductor femoris. Exactly.
Alrighty.
Exactly. You're welcome. So, yeah. So, again, that is the way That's how the semimembranous, and here, actually, hold on. And you can see how they've labeled it here. Now, this is, the orientation is similar. Pectineus, adductor longus, adductor femoris, shark tooth, and semimembranosus. So, there. The quadriceps on this label are kind of janky, not incorrect, but janky. But the adductor muscles up until the semimembranosus, because the semimembranosus technically is not an adductor. The orientation stage in the book. I'm sorry, Gloria, help me out here. What do you mean?
That's the orientation that they use in this exact picture is the same way that it looks on page 111.
Oh, thank you. Awesome. All right, guys. Page 111, everybody. Thank you. Very nice. You are correct. Awesome. Very good. So good. This one is helpful. But this picture, again, from the publisher, but a different thing. This is, this picture is good for adductor plus the adductors, pectineus, adductors, and semimembranosus. These quadriceps are kind of janky, so just be a little about it. The picture on 111, thank you, is a good image to orient you. The only problem is you have to flip it based on Kimberly Dutton, right, guys? So you want to just basically turn it to where you've got the rings facing towards you. Is that it? No, maybe a little bit further. Nope, upside down. I don't know. Anyway, you can see on page 111, pectineus is medial to the femoral nerve. Adductor longus is medial to the pectineus. Adductor femoris is continuing medially from the adductor longus, and then you can see the semimembranosus here. So this is a good picture to take, and then you can take this one here. Okay, and yes, yay, image is on here. Also, check your video, the Vimeo for the lab, in case you need another image. All right, guys. So with that being said, let's keep going with too far. All right. So, all right, guys. Where is the pectineus? Now, I recommend doing it this way. Go femoral vein medial to semimembranosus. Okay, good. Where is adductor longus? Great. Where is adductor femoris? Where is semimembranosus? And this is big. Semimembranosus looks big on here. That's why it's a little confusing the way they've done this, but I think they had to. Because if they put semimembranosus under ventral, everyone would lose their mind, right? Because it's like, wait, that's not right. The hamstrings are in the back. And they are. It's just this model, because of the splaying of the leg, meaning you get this lateral part of the back of the leg, popping up. All right, guys. Does anyone have any questions about that? I just want to make sure that you guys get that. I don't think it's confusing, but the way they've separated it. Okay, good. Awesome. And Gloria, thank you for bringing my attention and everyone's attention to that. It is definitely a good thing to go check that out at page 111. Awesome. Sweet, guys. Appreciate it. That's great. Okay, so not bad, not bad. Awesome. Now, this is just an image of the tibialis anterior and then the gastrocnemius. Okay? No problem. Straightforward. Now, I don't know why I have this in here twice, because we saw this before. We did this. Wait, where? Do you want the labeled image? This one? Okay. All right, no problem. And again, guys, this is nice because they do give you some labels. They do give you some labels within the lab manual. Not everything, but most things, which is kind of great, actually. And that's a good thing to kind of reinforce this as well. So, and when in doubt, you can always just hop on the video as well. All right, awesome. We did this already, so I'm just going to keep going. Okay, now, with that being said, I'm actually going to go back because I jumped past the quadriceps. Okay, now, okay, I'm going to give you the opportunity to look at this picture. Now, if you want, you can take a picture of this. So let me tell you what's good and what sucks of the quadriceps. So in this picture, this is nice for the adductors / semimembranosus, right? Which is definitely part of the hamstrings. This one here is going to support what you saw on page 113. Yay, that's awesome. We want it simple, not 113. Where was I, Gloria? Thank you. I'm like, help me out here. 111. Thank you, guys. So this image is a good support for that. Now, as we stay in page 111 as a good reference for you, because I'll tell you what I don't like about this image. Okay, I don't mind the rectus femoris. That is good. Tensor fascia lati, I don't like that at all. It should be labeled up here. Okay, just FYI, follow the lab manual for that. Otherwise, again, adductor good, rectus femoris is good. Okay, that's good. Now, vastus lateralis is correct, but janky looking. Vastus medialis is correct, but damn, label it here, people. Why do you have to be like that? So again, adductor muscles plus semimembranosus, but seriously, right? You see it, like adductor plus semimembranosus, they're good. You can use this image if you want to use it. Obviously, page 111. The quadricep muscles, which they don't include the tensor fascia, that's not part of the quadriceps. The rectus femoris, vastus lateralis, vastus medialis. Rectus is good here. That's medialis, and lateralis is here. You see, I don't know why they labeled it so janky. And I don't like the tensor fascia lati here. I don't like labeling it there because that's not where you're going to see it. Look at the 111 and then you'll see it really nicely. Okay, with that being said, if you like this picture and you want to you want to take a screenshot, go for it. That's why I have it. It's just one of them it's not super helpful. Okay, this is your quadricep picture, right? So where are we? Cat's tail, leg. Okay, guys? Abdomen, ventral. Just to reinforce that, really, it's the cat's tail. That's what's gonna, that's the leg. Now, just as a reminder, this here is the gracilis. Okay? So I've got the pectineus. They're not going to ask you here. Adductor longus, peekaboo adductor femoris. They're not going to ask you that here. They're going to ask you for this. Okay? What is this? Well, now, normally my advice has been start superior or inferior, right? For the chest, the pectoralis grouping, I like inferior. For the abdominal muscles, you got to go first layer, second layer, third layer. It's just the way you got to go, right? For the adductors, just start at that femoral vein. For the quadriceps, I'm going to go a little different. I like starting, boom, right in the middle. I like finding that rectus femoris right away. Why? Because then you go vastus lateralis or vastus medialis right away, right? Vastus medialis, vastus lateralis. So Dr. Schultz recommends starting laterally or medially, whatever you guys want to do, right? I'm not going to be in your home saying, you've got to do it this way. But for me, when I see this orientation, and I know this is a leg, because that's the tail, right? So it can't be an arm. I know that's the abdomen, so this is all the front. Then when I look at this part here, because, guys, look, we've removed, see what we've done here? Sartorius, transected, opened up, and pinned back sartorius. Yes, Brisa. No, I probably wouldn't have said it. But I'm just kind of assuming that you're following. We're waiting for Gloria. Sorry. That was Listen, it's the Friday before your spring break, and it's 7:30. Actually, my Tuesday class, my God, people, my Tuesday class is 10:20. We go till 10:20. So about 9:30, everybody loses it. Like, literally, it's it's freaking brutal. Yeah. Oh, Nutri. Gloria, you lost your position. Wow, it's competitive up in here. It was brutal. It's really freaking brutal. But anyway, she can regain her title. Okay, guys. So, yes, this is the Sartorius transected, just so that you know where we are. And yes, Brisa, Gloria, you snooze, you lose. This part here would be under the quadriceps. Right now, guys, page 111. Thank you, Gloria, for that. This is where you can continue to look at, right? So 111 is great. Again, we don't do really sheep's brain we did, but other than that, we really don't label the manual. So we're here under the quadriceps femoris. Again, like I said, I like to go right to that rectus femoris because it's just easier than for me to go, okay, that's vastus medialis, because that's the midline. Right? Going that direction is the midline, medial medialis. And then going out, if you like the idea of starting at the rectus femoris, then going out to the lateral side, right, the side, we know that that's going to be vastus lateralis. Now, it's just this. Why? Because guess what we have here? Iliotibial tract. Now, you can see it, but we've kind of moved it out of the way a little bit to see this beautiful tensor fascia lati. Look at this. Look at that. A moment of silence for this beautiful tensor fascia lati or latte. Oh yeah, the vastus intermedius. I don't know, you tell me. You can't see it. The vastus intermedius sits underneath, it sits deep to the rectus femoris. So we have to actually move it out of the way. And you can see it if you move it out of the way, but then you can't really see the rectus femoris. So we don't really have any images that show the vastus intermedius. Just like if you look at the leg model, we have to take out the rectus femoris on the leg model and go deep to it. But we don't have any images where we've actually done that. The only time we've done that in the model is when we've removed the antebrachialis in order to the brachioradialis. Oh, I lost my mind. When we removed the brachioradialis, excuse me, correcting myself, in order to see the supinator. So on the model arm, you've got the brachioradialis, you've got the pronator teres, and we've removed in one of the pictures the brachioradialis so you can see the supinator. But that's the only muscle we've removed in the models. So because the vastus intermedius is deep to the rectus femoris, we'd have to move it to see it. That was really long to say that we can't see it. That was a lot. But now you know why. So no vastus intermedius that we can see. All right, guys. Awesome. With that being said, where is... It's so bad, but so true. Me trying to convince you that you really, really can't see it. Trust me, you cannot see it. And I'm going to prove it with a dissertation. Wow. I'm making up for the film terminal. Anyway, okay, guys, ready? Let's start with rectus femoris. Where is it? Yes. Vastus medialis. Yes. Vastus lateralis. Be careful. Don't go too far here. Yes. Stay just there. That's the vastus lateralis. Because where is the iliotibial tract? Yep. It's a thick, comparatively, connective tissue, and it's just awesome. Now it goes much higher up, but here they've kind of, I don't know that they've removed it, but you can't see it as much going up. Because where is the tensor fascia lati or latte, whatever. That's it. Perfect. Awesome. Theoretically, we could ask for the gracilis. We wouldn't ask for any of those adductors here. That would be weird. I don't think we'd ask for the gracilis, but where is the gracilis just for kicks? And what did we do with the sartorius? Oh, I don't think we'd ask for the sartorius, but just so that you know, we have to remove the sartorius, yes, to get to the quadriceps femoris. Boom. And just to reiterate Estella's question, you can't see the vastus intermedius because we haven't done anything to the rectus femoris. We have to move it. Yeah, it's deep to the. Now this is we'd have to move the rectus femoris to be able to see it. Right now, all we see, bit my lip, is the rectus femoris. All right, good job, guys. Okay, awesome. Now we just finished the deep muscles, but I'm going to ask you about them. All right, guys, are you ready? I'm going to go in the order that I recommend from the femoral vein. Pectineus, go. Awesome. Adductor longus, go. Adductor femoris, go. Yep. Semimembranosus, very weird and counterintuitive, but because of this play, yes, it's in the back, but you can see it here. Awesome. Now, just so that you understand how this works, where is the gracilis? And somebody went down there and left. Yeah, that was it. All right, great. Was that you? I thought Jennifer's like, oh, I'm not doing it. I don't think we're going to ask you. Yeah, exactly. She was like, no. It was good. All right, guys. Just so that you know, where's the sartorius? So in this case, we kept the sartorius closed so that we can focus on those adductor plus semimembranosus. That's it. Awesome. All right, guys, don't forget, there's the tail. There's the tail, which means leg. And there's the abdomen, just to remember that we're in the ventral or the front part. Okay, guys? I don't think it's that hard to tell, but I do want you to remind yourself. Whenever you see an image, or immediately say, that's the front, that's the leg. That's the back, that's the arm, right? Exactly. Hairball, scrotum. Exactly. Brisa.
Would they ever ask us up here?
No. Oh, God, no. I mean, okay. No. I mean, first of all, look at it. They butchered it.
Yeah.
They probably started out over there. I was like, damn, let's go to the other side. It's a good question. No, that would be crazy. That would be crazy. But the same thing would apply that you would start from the right there. And they butchered it. All right, good job. Good question. All right, guys, awesome. So again, now we finished up that. We're going to go to the head in a second. But basically, the only thing we have in the front is the tibialis anterior. So for the ventral, inferior to the knee, it's just tibialis anterior. Gastrocnemius, we're going to see when we get to the dorsal side. Okay, we saw this again. All right, now we're kind of going all the way back up to our list on ventral muscles. So we're going to knock out the mylohyoid, digastric, sternomastoid, cleidomastoid, masseter. All right, so let's knock this out. So the masseter is the ball. Looks like a ball. You guys see that? We can't really see it on the other side. So I wouldn't even bother. Don't even bother. Where is it over here? Here is where we're going to ask. That's the masseter. That's it. It's the ball. Okay? Now, digastric is quite straightforward also. It is like a V. Here. Now, we're not going to ask about this, but it's not that. Okay, so the digastric, di meaning two, right? Gastric meaning, usually I think of stomach more, but, digestion. All right, that's it. Looks like a V. Okay? Mylohyoid is just underneath that. You see this? That's it. I mean, it extends a little bit down more, but that's it. You guys see that? And then, so that's your mylohyoid digastric. Now, in people, we have the sternocleidomastoid, really big muscle that goes from the sternum, clavicle, all the way back, right, to the temporal bone, the mastoid process. Here, the cats are separated. So that's why they have a sternomastoid and a cleidomastoid. Whenever you see cleido, it's associated with clavicle. Sternomastoid looks like this. It looks like a V here. Okay, guys? That's it. It's a quite superficial muscle. Now, the cleidomastoid is actually a deep muscle. See that vein there is the left internal jugular vein of the cat. It's the jugular. Okay? So you kind of have this weird V pattern at the top, digastric, right? That's your first V. And then you've got the other V down by the clavicle, the neck, the sternomastoid. And then you've got the deep muscle, which you can see that actually had to go deeper in order to get to the cleidomastoid. And they wouldn't do it over here. I mean, technically it would be here, so I guess they could ask, but it's really pretty on this side. So technically it would be here. The way you think about this is simply this, right? You got a V here, which is the digastric. You got a V here at the neck, which is the sternocleidomastoid. And then lateral to that vein is the cleidomastoid, right? So that one would be, well, I guess, what about here? So you can see how that works. And the masseter, which I told you on this side, the ball. All right, guys, are you ready? Where is the masseter? That's it. Oh, not the black. Yeah, I know, it's a little bit tricky, but we're not going to ask about that black area. We're just going to ask there. All right, one more time, guys. Where's the masseter? That's it. There's nothing that we want over there. All right, awesome. Now, ready? Digastric. Digastric. Di meaning two. Yep, it's the V, right? It's the V. Good. Now, where is the mylohyoid? That's it. It's just under, yes, it's underneath there. And it's the same with us. That's how we look. The digastric and the mylohyoid. All right, perfect. Now, where is the sternomastoid? Yep, it's the other V, right? It's the V of the clavicle, or sternum. That's more appropriate. The sternomastoid. Excellent. Now, the cleidomastoid, find your jugular. That's it. Cleido. Now, it could be on either side, even though that first one I showed you is prettier. But you can do either. So it's going to be lateral to the jugular vein, and it's going to be deeper, so you can see that flap. And just as a reminder, although I don't think we would ask here, pecto antebrachialis, pectoralis major, right? Got to go inferior for minor. Okay? All right, guys. That's it. Let me make sure. Oh, biceps brachii. Okay, hold on. I got to keep going. Oh, anyway. Any questions before we keep going? It's not that bad. It's pretty good. Okay? And we've covered everything else. Yeah, it's not that bad. It really, really isn't. Right, guys? Just knock it out. Don't, remember, you guys are working hard being engaged with this class. If you get on it tomorrow, I know it kind of is, isn't it, Brisa? Sorry. But also, the human is not that bad. It's just the biceps it's just the upper arm from the back and front. Yeah. Maybe. That's it, Brisa. I'm going to go with that. All right. Now, hold on. I got to do some, scalenes. Okay. Scalenes, we don't see, hold on one second. Hold on. Okay. Yes. But I got to find it. Now, and I'll tell you why. Hold on. Okay. Now, so scalenes are weird in the cat. Scalenes in us are the lateral muscles of the neck, right? We've got the anterior and the posterior, and I think it's the middle is the superior. But I can't remember. So it doesn't matter. We only ask for scalenes besides the sternocleidomastoid in our body. This is the image that you want for the scalene and the serratus anterior. Now, the serratus anterior, super easy. I mean, they did a beautiful job here. This is the serratus anterior, right? Awesome. The scalene, this thing here. I know it goes all the way down to the rib. Now it comes up, so it comes to the neck, but we don't get it when we do the dissection. So that is the scalene. I know. I don't know what to tell you. That's it. Let's see if we have an image with it labeled, which we might or might not. I know, crazy. It's crazy. It is. It's medial. So it's well, the way they've cut it looks like the way they've cut or they separate the serratus anterior does look like gills. They've just done that for your benefit so that you can see it. I'm just seeing if we have a picture labeled of it. Looks like the cat has wings. I know. All right. That's.
Brisa said 109.
Oh, thank you. Oh, thank you, Brisa. Or Sophia. Thank you.
And
All right. I missed it. Thank you,
on
Brisa.
Sophia.
Oh, Sophia, you're getting your due. Oh. Thank you, Sophia. 109. Awesome. Actually, yeah, that's great. But, okay, guys, be careful of your lab manual. You can see how the serratus anterior are very clear, but the scalenes are kind of high on the image, new assistant, I know, a little bit high on this 109. What they've made a clear kind of cut for you. Unless, no, there's no way. Could it be here? I don't think so. Okay, listen, it doesn't matter. This is the way you think about it. There's only two labeling on this image. Clearly, it's the serratus anterior here, because you've got to go super deep. I mean, look at that. They took off the whole pectoralis grouping. Now, this one, to me, is what I thought was the scalene, but this labeled looks like it's more here, but it doesn't matter. Do you guys know why? Because that's the serratus anterior, and anything over here is the scalene. So on this image, the way they have it labeled, it's a little bit more, no, yes. Okay, it doesn't matter. It doesn't matter. The bottom line is serratus anterior, very obvious. This area here, whether it's here or here, is going to be the scalene. You guys good? That's it. Yeah, I mean, that's it. Don't stress yourself out. You got two labels here, and that's it. As I'm looking at this, I'm like, oh, wow, maybe I have it a little bit lateral, but it's fine. And actually, maybe that is, it's just the way they've cut it. It doesn't matter. Here, anywhere here is the scalene, and be done. Are you guys good with that? Because there's nothing else we're going to ask this deep. And obviously, that is the serratus anterior. Okay, awesome, good. All right, awesome. Okay, now, forget that. That's not going to help us. I want to find you the biceps before we keep going. Hold on. I got to find the biceps. Okay, that's it. All right. From the images that I have seen, the only one that I've seen a biceps brachii is this image, right? Because first of all, obviously this is anterior or ventral, right? So this is the front. Okay, that's obviously important. Obviously, there's the head, so there's the arm. Obviously, that's important. And what they've done is you actually notice how they have to push back. We've got different muscles here. First of all, we kind of get the extension of that pecto antebrachialis, and then we have a little bit on the top for the clavodeltoid, which we'll see later. So we have to kind of dig in a little bit, and we see it in the anterior part. That's the biceps brachii. And nothing else is open here, right? So we're not looking, and nothing else is cut here. So the only thing we're looking for on the anterior or ventral part of the cat, right? Ant, ventral, front, that's your head, is the biceps brachii. Okay, guys? It's the only one that I've seen where that's open. The other images of the arm from the front are not open where you can see it. So that is the image for the biceps brachii, and you can see it on page 109. But you can tell that they've taken it separately because they put the flap back down. Remember they have the flap up? Really? You think it looks deeper there? I think it looks deeper here. Either way, it doesn't matter because this is the only image that shows the arm in the front with a deeper muscle. None of them have this image. And what they've done is do you see how they used the image for the serratus anterior. Hold on. I'm going to come back to all of that. Don't worry, that's later. Okay, do you see what they've done here? So see all this pectoralis groupings that they had to cut and open, right? Then they were able to get you your scalenes and your anterior. And then here, you can't even see it. You can't see that. But if we go down, down. I don't know why I put it here, to be honest with you. Sometimes I don't know what I'm doing. Or not what I'm doing, but why I do something. What they've done here is they've put all of that pectoralis grouping that they moved to get the serratus anterior, they put it back, and then they cut deep for that. So, it's the only one that has that, so there's nothing else it can be. Okay? Okay. Yes, Dominique, we did the tensor fascia lati. Page 111. Very good. And just remind me at the end, we can go back if we finish up a little bit earlier as well. Okay. All right. Does that make sense, guys? You can't see the anterior, the serratus anterior here, because obviously it's underneath. We're not going to ask about the pectoralis muscles, although, because this is kind of hard. You can't see all of them, right? Xiphi humoralis, pectoralis minor, pectoralis major, pectoantebrachialis, but this is what they want. Masseter, but then not here. All right, guys? You good? We good? Okay, good. All right. And again, I've gone through different images, and I'm like, well, where else could it be? Nowhere. Email it to me if you find another one. All right. So with this image, now, okay, guys, hold on. Okay. So now, okay. Confirm for me, because apparently I like to skip things, not purposely, just because I don't know. Confirm that we have done everything in the ventral muscles. We should have done everything. We just finished off those scalene, serratus anterior, and we did the biceps brachii. Okay, awesome. Now, we are on the dorsal muscles. We have 25 minutes, so let's knock this out. Okay, so everybody, page 119 under dorsal muscles. Also, you've got some labeling through here, which page 117 on, which is great. Lied, 115. It's actually quite good. All right, guys, here we go. Let's do it. Okay, these are good images. This is a good image. Very, very nice. Okay, everything is really nicely labeled here. This is not a bad thing to get, so feel free to do your clicking. Where I want to start is with the trapezius muscles. Okay, remember the trapezius is going to be this kind of, I guess, trapezoid? Looks like a diamond to me, but whatever. So it's going to be that kind of diamond-shaped muscle, right? So what are we looking for? I like inferior. If you like superior, go for it. So inferior, we start with, now, careful. Don't say this is the Xiphi humoralis. That's the front. We're in the back, right? Obviously, this guy has a cap. We don't have that. You got to orient yourself immediately. Front, back, leg, arm, cap. That's how you have to do it. So what we have here, but you can see that difference in the muscle fibers. This is the spinal trapezius. Boom. Okay? Acromiotrapezius. Boom. Okay? Clavotrapezius. Basically, the neck. Okay, guys? Now, I'm kind of sticking on the right, but obviously the same as on the left. Okay? So that's what we want to focus on for this grouping. And I'll do latissimus dorsi just because. Big muscle. Look at that. Although everything I just told you is technically we have the trapezius, right? We don't separate it. We just say the trapezius. All right. Awesome. Don't care